A lot of RTs, when talking about practicing at the top of our scope, focus on doing more procedures, bronchs, intubation, chest tubes, A-lines, those kind of things. And don't get me wrong, those are good skills to have, but they are merely technical skills. You can train any clinician how to do it with enough practice, whether it's RTs, nurses, paramedics, mid-levels, physicians. Anybody can do that with enough practice. You can easily teach the nurse how to adjust the BiPAP mask, sling a neb, draw an ABG, EST the ventilator, right? Those skills, while good to have, they do not make us clinicians. And for a long time, we were considered technicians because our job mainly just involved setting up and calibrating equipment. Now, those days are long gone, but we still put so much value on the RT's ability to master equipment and technical skills. Those things do not make us uniquely valuable. What makes us uniquely valuable is our ability to gather information, analyze it, and make clinical decisions independently. And that requires the vast depth of knowledge that only we possess. What makes us clinicians is our ability to operate independently through protocols, to act as educators for our patients, and as disease managers. Those are things that cannot be so simply taught to some other professionals. Those are the roles of RTs in some places, where in other places they simply set up the equipment. We should strive to be clinicians, not technicians, because only one of those roles is going to carry the profession forward. In one of the states in the South, there was a recent proposal to basically make it so that freestanding ERs do not have to staff RTs. Now, RTs online were making a big stink about this, saying, we can't let this happen, it's going to put patients at risk. But at the end of the day, will it really do that? Are there not nurses qualified enough to be taught those technical skills? Can a nurse not, grab the intubation supplies and plug in the vent settings that the physician dictates? I think they can at the end of the day. I think they can be trained to do that. And I think what's happening in this situation is that RTs have not proven their worth beyond simple technical skills. So the powers that be are now asking, well, do we really need them? If all they're doing is, pushing buttons and turning knobs and grabbing equipment, why can't we just have the nurse do that instead? But what if the RT played a role that was harder to take away? What if the RT was truly managing the vent? What if the RT was actually titrating meds and modalities independently based on a protocol? What if they were providing education, training to patients with pulmonary diseases? Those are things that only we can do with our depth of knowledge. Those are things that will not be taken away from us. But as long as there's this perception that technical skills are what makes us valuable, we will be competing with other clinicians for our jobs.